Good evening, this is Dr. McDaniel. It's Monday, April 29th, and we're continuing on the information on menopause. So as I mentioned yesterday, menopause is defined as not having had a menstrual cycle for at least a 12-month continuous block of time, and having either signs and symptoms of menopause and or blood testing to confirm that your hormones are menopausal level. That being said, the average age for menopause is 52 to 54 years old, but it can occur anywhere throughout your lifespan, of course, but normal would be between 42 years old and 58. Unusually young is anyone 41 years old and under. We call that early menopause or premature ovarian failure. The most common signs and symptoms of menopause are hot flushes and sweats throughout the day and especially in the evening, insomnia, fatigue, breast tenderness, bloating, irritable, moody, angry, depressed, emotional, anxiety. The insomnia is one of the most common, but fatigue also follows with that. Vaginal dryness or discomfort, decrease in libido or sex drive, and for some women, dry skin and dry hair or hair loss or hair thinning are the common signs and symptoms of perimenopausal, and then once there isn't a cycle for 12 months, menopause. And lastly, which a lot of women complain of, is a mental fog or decrease in mental acuity, memory loss, especially for short-term memory loss. As I mentioned yesterday, a lot of the treatments are prescription-based, are to address what happens during menopause, and that's estrogen loss or what we call estrogen deficiency. So the mental fog, the decreased acuity, even Parkinson's has been strongly linked to the loss in estrogen levels. So hormone replacement, which is essentially replacing the estrogen that's decreased dramatically from menopause, was thought to help that. It's been largely debunked, but not completely. Cardiovascular disease, so heart attacks, has been linked to that drop or loss in the estrogen levels. So the hormone replacement was used to decrease that possibility. The catch with the heart attacks is that the Women's Health Initiative confirmed that that really only helps if you don't have a break or a breach in that estrogen loss at all. Pelvic floor dysfunction, so urinary stress incontinence or leaky bladder, urinary loss, is common after menopause, and that's because the pelvic muscles are responsive to estrogen. With the loss of estrogen, the pelvic muscles become thinner, weaker, and can drop or allow for bladder leakage to occur due to weakness of the trampoline muscle, pelvic muscle. The pelvic organs, the bladder, the vagina, the uterus, and the rectum, those are all supported by the pelvic muscles. So once that estrogen loss occurs, the muscle is thinner, weaker, and you have what we call prolapse, which is loss of the normal positioning of those organs, so they can actually fall or sink through the vaginal vault, through the bladder, and through the rectum. So you have those organs literally trying to fall out or fall through the vaginal vault. One second. The prescriptions do help all of those signs and symptoms, and they also help, obviously, the hot flushes, the night sweats, those are the major ones, and the insomnia, fatigue. The catch, or the fly in the ointment, as I like to say, is that the estrogen replacement or hormone replacement, which included estrogen and progesterone, the small catch is that they do have a slight increased risk of breast cancer associated with them. And for that reason, we call it a 1.1 relative risk increase in breast cancer. For that reason, the flurry of hormone replacement prescriptions came to a screeching halt around 2004 to 2005. And the American College of OB-GYN recommended that the hormone replacement really only be prescribed, obviously, after a normal or negative mammogram has been obtained, and only for women who have hot flushes and sweats that compromise activities of daily living. So all of the other factors that were aided and decreased and helped with the hormone replacement were no longer deemed important enough or strong enough reasons or benefits to risk the slight increase issue with breast cancer. That being said, even for hot flushes and sweats that are disruptive to activities of daily living, the hormone replacement was only recommended to be given in spurts. So a 2-year block of time, and then decreased or stopped, see how the person does, and then restart it if they're still having issues that are disruptive. For that reason, a lot of women have turned to non-prescription supplements or supplements that are over-the-counter or can be provided at a compounding pharmacy. So a pharmacy where the supplements are natural and not the synthetic prescription ones that we predominantly prescribe. The most common supplement in that scenario is going to be the estrogen and the remifemin. Those are plant hormones that you can get over the counter, non-prescription. Those, again, same as the prescription ones, they do need to be taken every day, so they're a daily basis. They will help predominantly with hot flushes and sweats for most women. Nothing works for everyone, but you can get the majority of women will get help from those. In addition to that, 100% natural progesterone. You can get that over the counter without a prescription. The progesterone needs to be applied in pulse points, and most women will need to do the progesterone every day. That works really well, especially in conjunction with black cohosh, which is a plant hormone. You can get that as a tea or pills. The catch with the black cohosh is it's not supposed to be taken every day ad infinitum. It's supposed to be taken just until the symptoms have reduced enough for you to feel comfortable. So most women will only take the black cohosh daily for about a 6 to 8 week or 8 to 12 week block of time, and then take a break from it, but continue the progesterone. Other popular supplements that do seem to help are wild yam. The wild yam can be taken in a pill form. It can also be used as a cream. It has an estrogen effect because of the yams have, once they're processed, have an estrogen effect. So it does help predominantly with flushes and sweats, and for some women it will help with the fatigue, insomnia, and some of the emotional issues. Another popular one is evening primrose oil. A lot of women take evening primrose oil even before they're menopausal for premenstrual symptoms. The evening primrose oil has been known to help quite a bit with breast tenderness, bloating, and some of the mood, emotional issues. Flaxseed oil is another one that's very helpful. And I've had several patients mention that they got good results from Lady Pinkham or Lydia Pinkham. It has 2 names. It has several herbs. It has about 7 or 8 herbs with it. One of the herbs is the black cohosh. It also has iron supplement, and a lot of women are deficient in iron, perimenopausal, premenopausal, and then early into the menopause. That again is another pill that needs to be taken every day. And then Dong Quai or Dong Quai is a supplement that helps a lot with emotional issues such as anxiety or depression. That's another one that shouldn't be taken every day ad infinitum, but can be taken for bursts, for blocks of time, 2 to 3 months, and then a break once you feel like the symptoms have been abated, alleviated, or improved. Those are the most common ones. Another one is the pine bark extract. I've had a handful of patients over the years who've had good results with the pine bark extract, and that's more for, again, hot flushes and sweats because it acts as an estrogen derivative. And then lastly, a lot of women, it's really just an issue of stress, because a lot of women will notice that they'll have worsening symptoms when they're stressed. So yoga, which is yoga and Pilates, those are both exercises that work really, really well at decreasing stress, emotional stress, physical stress, and in turn, they will help decrease symptoms, side effects, and signs of menopause. So that wraps up the menopause issues and information. I hope that was helpful. And tomorrow I have a viewer question on the vaginal infections. I directed her to some of the previous broadcasts. I did a big segment on vaginal infections. I will answer her question tomorrow on recurrent or repetitive vaginal infections. And I'll answer another viewer question on breast lumps and breast pain. So 2 viewer questions will be answered tomorrow, Tuesday, April 30th. I hope that was helpful. Thank you everyone for joining GYN Corner. This is Dr. McDaniel. I also have a YouTube channel that I just started so that it can log the talks that I'm mentioning. It's hard to go through the Facebook and try to roll back through the live streams. It's kind of hit or miss. So I started a YouTube channel. It's also GYN Corner, and it has everything labeled and logged according to the session. So I hope that that's beneficial. Thank you very much. Have a good night, and see you tomorrow.